Lyme disease has a history that pervades the globe. Ticks, the culprits, have carried Lyme disease for thousands upon thousands of years. In fact, a recent autopsy provided evidence of the Lyme disease bacteria existing in a 5,300-year-old ice mummy found in the Alps. Strangely enough, it wasn't until thousands of years after our mummy friend was born that a physicist in Germany by the name of Alfred Buchwald first described the chronic skin rash that is now known to indicate the presence of Lyme disease. Recognition of the disease didn't come about until about the 1960s in the United States. It was then that a mysterious series of rheumatoid arthritis cases occurred among children in the city of Lyme, Connecticut, and 2 neighboring towns.
Hi, I'm Alex Blair with your Epidemiology report. It's gonna be a hot one today. In southern Ontario, we have a severe Lyme disease warning. As you move up to cottage country, the threat diminishes, but make sure to take appropriate precautions. If you're taking a trip down to the US, make sure to be careful because we've had increased instances of Lyme disease since 2001, as shown by the blue dots. Whoa, look at that growth. One of the vectors of Lyme disease is the black-legged tick, and it's coming in from eastern United States and moving into Central America. Whoa, on the western side of the country, we have the western black-legged tick, which is moving in from the Pacific coast. Be careful, those guys are nasty. Now back to Ron Burgundy with our headlines.
Hello, and welcome to Tick Tock, quick meals without the thick feels. I'm your host, Patricia. Today we're going to be making a delicious tick souffle. Now, of course, for this delicacy, you can't just use any tick species. You need to hit up your specialty market and pick up ones that can carry the bacterium Borrelia burgdorferi. That's what's going to give your souffle that unique Lyme disease flavor. Now, there's no need to worry about infection, because you can't contract Lyme disease unless these suckers bite you. And they can't do that when they're dead. Kill them, please! Oh, cut! You really gotta give them a good flam because these things don't die easily. This Lyme disease souffle is best for a spring or summer dish because you just won't be able to get these ticks fresh and local at any other time of the year. First, you're gonna want to marinate your ticks for at least 36 to 48 hours, which is how long it takes for the bacterium that causes Lyme disease to transmit. Now, ticks do favor dark, moisture areas of the body, which is why they complement this souffle so nicely. Now, if you're gonna bring this souffle with you on a nice picnic, that's where you've got to be extra cautious, as deer or squirrels can carry ticks that might give you a nibble while you're nibbling on their friends and family.
Your results are in.
What is it, doctor? I thought this was just a routine checkup.
I'm afraid it's much more serious than that. The rash on your arm, it's...
Yes, doctor. What could it be?
From a tick.
Oh no, doctor. You can't be serious. It can't be true.
Well, you do have an odd-looking rash that appeared on your arm when you were frolicking through that field with your fiancé, right?
Yes, I do. But he's no longer my fiancé.
I'm sorry to hear. And you've been feeling ill? Not like yourself?
Yes, doctor. But I thought it was from the breakup.
Well, that might make you feel down, but are your joints swollen and achy, making it hard to walk?
Yes, doctor. But I didn't think much of that.
Well, your antibody work indicates that it's Lyme disease. It looks like you've managed to catch it early on, so you're only at stage 1. The infection hasn't spread throughout your body, and a dose of antibiotics should get you feeling back to normal in no time.
But what if I'm worse than you suspect?
Even if you are at stage 2 and the bacteria has spread throughout your body, the antibiotics should still do their job and get you back to normal. Lyme disease is easily treated as long as you get prescribed, and complications rarely occur. Although if you experience any heart or joint irregularities or any cognitive defects, come back and see me. This is unlikely to occur now that we have you diagnosed.
Oh, thank goodness, doctor. I'm glad we noticed this rash and got it diagnosed so that treatment's an option.
But there is one more thing.
What is it, doctor?
It has to do with your fiancé and why he broke up with you. He and I...
I was out in the woods looking for a log to carve into a moose to put on my front porch when suddenly I was bitten by a tick and a bullseye rash appeared, and I went to my doctor and he prescribed me a slew of drugs. Now I'm popping pills all the time. Watch. do it!
There are currently 4 types of antibiotics which are proven to be effective against Lyme disease. They include tetracyclines, glycyclines, macrolides, bactilactams, and nitroimidazoles. Treatment options include oral, intravenous, or intramuscular antibiotics, as well as pulse and combination therapy. Ask your doctor about receiving oral antibiotics, which are commonly used in the earlier stages. If this doesn't work, intravenous antibiotics are used to combat late-stage infection in addition to other supportive therapies. If you have any issues with tolerating oral antibiotics, intramuscular antibiotics are always an option.
Side effects include diarrhea, upset stomach, sore mouth, skin color changes, rectum or vaginal itching, sunburn, loss of hearing, ringing or buzzing in the ears, feeling of fullness in the ears, increased thirst, needing to urinate more or less frequently than usual, unusual drowsiness, dizziness, or weakness.
Hello, boys and girls, and welcome to
No disease, please.
I'm Molly!
I'm Jimmy.
And I'm Bob.
What's the matter, Bob?
I just got back from a camping trip and now I have a rash.
Uh-oh! You gotta be careful when you're outside. Which brings us to the topic of the week.
Lyme disease.
Oh, fun.
Does that come from limes?
No! Stupid. It comes from bugs called ticks. Today we're gonna show all you kids at home how you can make sure you're safe.
Here are some easy ways to stay tick-free every time you go outside to play.
Use a bug spray and apply it all over your body before you go outside. Make sure that your mom and dad use a spray with DEET in it. Make sure you don't get this spray in your eye.
Ouch.
Or in your mouth.
Yuck!
When you go to play outside, wear long, light-colored clothing to avoid being bit by those nasty ticks. Every time you come inside, be sure to check if any of those little critters are stuck on you.
This is called the full body check, and it's done like this.
Under the arms, in and around the ears, inside the belly button, back of the knees, in and around all head and body hair, between the legs, around the waist.
I don't have knees or a belly button.
If you've been bit, be alert of rash and fever. Remove that tick right away with tweezers. You begin to feel sick, go see a doctor.
Gotta check for ticks. Gotta check for ticks. Make sure you look in your pits.
Look in your pits,
And your naughty bits.
and your naughty bits,
For those nasty ticks.
nasty ticks.